Hi, welcome to you all. My name is Dr. Manocha. I am a pain specialist. I work at the Max Hospital, Delhi as the head of the pain management department. Today we are going to talk about neck pain. So we are going to discuss about what causes neck pain. We are going to talk a little bit about the anatomy of what neck is made of. Then we'll move on to how we diagnose neck pain and how we treat neck pain. So, neck pain, why talk about it? It's a very common problem, perhaps one of the commonest musculoskeletal conditions after back pain. Now, the pain originating from the neck might not just remain limited to the neck, it will often radiate towards the front and cause headaches to people. It will often go down towards the shoulders and cause shoulder pain, and it can further radiate towards the arms, causing dysfunction of the arms. It's not uncommon for this pain to go down towards the blade of the scapula. It's not even uncommon for that pain to come forwards towards the front of the chest. So it has very different manifestations depending upon what's causing the pain and where it's originating from. Like the pain originating from the top of the head would generally go towards the front, causing headaches, whereas the pain originating from the lower part would often go down towards the arm and the shoulders. So apart from the pain, you also get limitation of the neck movements or the shoulder movements. You can have numbness or tingling or weakness of the arms, and along with these there might be tender points which you press on and you get severe pain. So that's a very common presentation as well. So moving on to the causes of the neck pain, the commonest causes first. The common causes are muscular or musculoskeletal ones, which means there is a muscle or a ligament involved and it's been strained or there's been an injury to it, and that often causes localized neck pain with limitation of the movement, which means you can't rotate your neck very often or as freely as you would like to, and simple activities like driving become a challenge. So that's a very common cause of neck pain. Apart from this, what we also see is a condition called spondylosis, which in simple words means age-related wear and tear. This wear and tear may be in the discs or in the joints of the spine or the spine as a whole, and that is a very common condition. Another common problem we see which gives rise to neck pain is disc problems. So if there is a disc in the neck which is bulging out, it can press on the nerves. So remember, the nerves coming out of the neck, they go into the arms and supply specific areas of the arm. So if there is a disc bulging out in the neck, it can be leading to pain going down the arm in the distribution where the nerve is going to. So that's again a very common cause. But the good thing about this is that most of the disc bulges would get better within 3 months. And if it's not getting better or it's causing weakness or numbness in your arms and it's progressive, that's the time to seek help from a doctor. Then there are other rare causes, causes like infections, causes like tumors, causes like trauma or injuries or fractures. Fortunately, as I said, they're rare. Then we also have to remember that there is a genetic predisposition, which means if our parents are suffering from these conditions, there is more likelihood that we may suffer from these conditions as well. So now, having known about the causes, let's move on to discussing a little bit about what neck is made up of and discussing the anatomy of the neck. So if I remove the skin of this model, you can see the framework or the skeleton. So the neck, which is between the head and the rib cage, is made up of 7 vertebrae or 7 bones stacked one above another, and I'm highlighting them one by one. So these are stacked one over another, and if we see it from the side, in between the 2 bones in the front is a disc, which is being highlighted by my pointer now. And on the back side, you've got the joints between the 2 bones of the vertebrae. If I put the skin back, that gives you an idea of how and where we are and what we are talking about. So that's a bone, and if we isolate that, you can see the center of the bone is a bit hollow, and that's where all the nerves travel from the brain to this is the hollow where the nerves are traveling or the spinal cord is traveling. On the sides, you've got the joints which articulate with the above vertebra and the below vertebra, or the bone above and the bone below. And then if I put this back again, and I would then put the nerves on, and you can see them as yellow structures coming out of the spine, and there's lots of them. So in between every two bones you've got nerves coming out. One special nerve we need to talk about is the one which goes upwards towards the head, and let me highlight that for you. That's over here. This is the occipital nerve, and this nerve often causes headaches which are localized to the back of the head, and that's a common problem which I see in my clinic, which is also called occipital neuralgia, or the pain originating from the occipital nerve. So now that we've understood there could be numerous causes of neck pain, the process of diagnosis often involves carefully listening to the patient, because the way the patient describes his or her pain often gives us a clue of where it might be originating from. So the process of diagnosis would involve a careful history taking, followed by examination of the patient, which again has clues, and then investigation. The common investigations we do include blood tests and MRIs, and often we would also ask for nerve conduction velocities and X-rays as indicated. And then what we try and do is we try and put all these pieces together and solve the puzzle as to where the pain's originating from. So the management would depend on the cause of the problem. Let me give you an example. Recently I had a young chap who had neck pain for a year, and despite all extensive investigations, no one could diagnose his pain. He tried lots of medications, but nothing was helping. And then we happened to take his blood pressure, and actually his blood pressure was so elevated that actually the cause of his headache was blood pressure. So we stopped all the injections and we stopped all the medications and controlled his blood pressure, and he got better with that. So the management would depend on the cause which is causing the headache. So let's say somebody's got rheumatoid arthritis. So apart from just managing the neck pain, we would also have to manage his rheumatoid arthritis to make him better and give him the best benefits. So coming back, most often people would need to avoid the triggering factors, and these could be simple things like raising the height of your laptop, adjusting the number of pillows you're taking so your neck is in a neutral position and it's not hanging this way or being pushed the other side because your pillows are too thick. It will often involve not being in one posture for too long, so taking regular breaks, things like giving up smoking. So these are all lifestyle modifications which most people would have to incorporate in their routine lives. Then along with these lifestyle modifications, we use medications. Medications may be simple medications such as gels and painkillers like paracetamol, or they may be specialist medications such as nerve type of painkillers such as anticonvulsants, which specifically work on the nerves. Then apart from these, we often use physiotherapy and mind-body relaxation techniques along with these measures, depending upon what's causing it. But coming down to one important modality, which is injections, which often gives people good relief and which can be long lasting. So again, the injections would depend upon the cause of the pain. Let's say there is a simple muscle spasm you have got because of a localized trigger point or a localized muscle injury. Injecting that area can give you long lasting relief, and the problem might not even come back after that. Then if the nerves are entrapped, there are specific nerves which we target. We talked about the occipital nerve in the anatomy video. So injections of this nerve can often relieve headaches at the back of the head, and also sometimes headaches which are even in the front of the head. So these procedures are OPD procedures, which means I do them in my clinic, and they're safe enough to be done as OPD procedures. Apart from these, there are some X-ray guided procedures which we do as day care procedures. Day care procedure means you come in the morning and you are back home in the afternoon or in the evening, depending on how you progress and what procedure you have done. So examples of these procedures include joint injections. Why we use X-rays? Because we want to be very specific where we are going, and we want to be safe. So X-rays help us localize these joints and improve our accuracy. So these are again safe injections of the joints which we can do, and they can give prolonged relief to people. Sometimes if the relief is not prolonged, we use radiofrequency ablation, which means We stop the nerves which are taking the pain signals from these joints to the brain. We stop them from working. So that's done using the radio frequency waves, and again, that's a daycare procedure as well. And that can give long-lasting relief to people, often lasting for years. Then there's another common injection which we do using X-rays, and that's an epidural in the neck. Epidural in the neck is a very effective injection for nerve type of problems, specifically if there's a disc putting pressure on the nerve. And what I found is that the epidural injections in the neck work better than the epidural injections in the lower back. And often they would either give you long-lasting relief, or in some cases which I've encountered, the problems never even come back as well. It depends upon what the cause is and how advanced your problem is. So using a combination of all these modalities, by which I mean using medications, lifestyle modifications and injections together along with physiotherapy, gives you the maximum chance of healing and getting a better quality of life. So thank you for listening, and I hope this information has been useful to you. Take care.